What is cystic fibrosis? Cystic fibrosis is when there is a mutation in your 7th chromosome. The 7th pair of chromosomes has a gene called the cystic fibrosis transmembrane regulator, or CFTR for short. For example, in the picture to the right shows what a normal airway looks like and what an airway looks like for a person who has cystic fibrosis. A normal airway looks red and mucus is hardly noticeable. In a cystic fibrosis airway, it looks green because there is too much mucus inside the airway, making it hard for them to breathe. To have cystic fibrosis, you have to inherit the gene from both parents. To find out if you have the cystic fibrosis gene, you could complete a diagnostic evaluation, including a chloride test, a genetic or carrier test, or you could go to a clinical evaluation at a CF Foundation accredited care center. If you do have cystic fibrosis, too much mucus builds up on the outside of your cells, closing the CFTR channel that lets chloride ions in and out of the cells. Chloride ions are very important for your body because they control the amount of fluid inside and outside of your cells. You can see them in the picture to the right. That the first one shows a normal CFTR channel bringing chloride ions in and out of the cell, and the second image shows too much mucus on the outside of the cell that the CFTR channel closes up and does not allow chloride ions to come out of the cell. How do you get cystic fibrosis? Cystic fibrosis is a genetic disorder, which means that both of your parents must have carried the cystic fibrosis gene for you to have this disease. But if someone only has one copy of the CFTR gene, they don't have cystic fibrosis, but they are carriers of the disease. If they are carriers, they could possibly get the disease later in life or could pass the CFTR gene down to future generations if the one copy of the gene is met with the other copy from someone else. For example, the picture shows that 2 parents had 4 children. Both parents are carriers of cystic fibrosis, which means that 2 of the children will be carriers of the disease, 1 child will be unaffected, and 1 child will have cystic fibrosis. Disease symptoms. Some disease symptoms include lung infections, which limit your ability to breathe over time. You will also have poor growth and weight gain, which would make your body weaker. You will have persistent coughing with phlegm, and you will experience wheezing or shortness of breath. You have to take many medications a day to help with many symptoms of cystic fibrosis. Each disease symptom of cystic fibrosis causes many different health risks because it can close up their airways, they could be allergic to something in a medication, and you could possibly get an infection. The buildup of mucus in their lungs also causes more risk for bacteria to build up, and that causes chronic lung disease. Cystic fibrosis patients always have to stay 6 feet apart because they are more at risk of catching each other's bacteria. If they were to catch each other's bacteria, they would have a harder time being able to have a lung transplant. The outcome of this disease is that there is no cure for cystic fibrosis. The only thing that cystic fibrosis patients can do to help their disease is by getting a lung transplant. Every patient has to take medications because it helps them breathe, and the medications are not optional. All cystic fibrosis patients live with the disease and spend most of their life in a hospital, other than if they have a lung transplant and they are healthy enough to go back to their own homes. Cystic fibrosis patients have to live with a disease that in some cases can be fatal, and they are always watched by doctors and nurses. They also take many antibiotics to help with infections if they have feeding tubes or just an infection from their disease. They also use a bronchodilator to help open their airways, and they use high-frequency chest wall oscillation, or HFCWO, is the vest that they wear to break up mucus. Thank you for learning about cystic fibrosis.